The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Alexandra Vandenberg, and I'm the Associate Director for the Michael and Susan Dell Center for Healthy Living, which is a research center within the UT Health School of Public Health. We're going to give it a couple minutes just to make sure everybody is kind of like rolling in right now. So we'll start within 1 or 2 minutes. Percy. All right, well, welcome again. I'm really glad to see so many people joining us. Want to start out with giving a brief intro and then introducing the speakers for today's webinar as well. So today's webinar is the second of a series of 5 webinars focused on our food system and food insecurity during COVID-19. And today's webinar will focus on Austin, Texas, and our 3 speakers will discuss what's been happening here in Austin for the past few months during the COVID-19 pandemic in terms of food insecurity, and then the creative responses that are being implemented by local organizations in the city. Our first presenter, Dr. Katie Jonda, is a National Cancer Institute postdoctoral fellow and has nearly a decade of experience working on public health-oriented and transdisciplinary research projects focused on community health promotion, food insecurity mitigation, and food systems. She's been assisting the city with analyses of food-related 211 call data, and will discuss the changes in calls for food emergencies that have occurred during these first few months of the COVID-19 pandemic. Then our second presenter is Sam Knight, who is a planner in the City of Austin's Office of Sustainability, where she advises the city's food policy manager on policy issues related to food access and food insecurity. She holds a master's in public affairs from the LBJ School at UT Austin. Her background is primarily in federal food assistance programs with a focus on SNAP policy and the SNAP employment and training program. In her presentation, she will discuss the city's response to the significant increased need for access to food among Austin households. And then lastly, our last presenter is Heather Hellman, who is the Food Access Director at Farmshare Austin. Prior to this position, Heather lived and worked in Buffalo, New York, where she focused on urban food policy and land use and helped manage a cooperative urban farm on Buffalo's east side. She currently oversees Farmshare's food access programming, which recently expanded to include the new Curbside Deliveries program, which she'll be discussing in today's presentation. Now, before we get started, I just want to make some housekeeping announcements. So first of all, this webinar is being recorded, and we will archive it along with the presentation slides on our website, which is msdcenter.org. And we'll say that again at the end of the presentations. And then if you have any questions during the presentations, because we have 3 different speakers, it will be best if you can just go ahead and enter them in the chat box, but we will let all those speakers go through their presentations, and then we'll take all the answers at the end, just to make sure we have enough time. And so having said that, I will now hand it over to Katie to start her presentation. So Katie, it's all yours.
Thank you. Okay, so before we get started, I wanted to give a little bit of background information on food insecurity and food access and what that looked like pre-COVID-19, and then some things that we're hearing from the ground and with data during COVID-19. Next slide. So to briefly define food insecurity is is defined as a limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. And this definition comes from a meeting of the Food and Agriculture Organization. And I think helps provide a little bit of context, because I don't know about you all, but when I started doing work with food insecurity, my family and friends didn't quite know what that means. And then suddenly during COVID, it's all over the news. And I think not everybody necessarily knows all the different components of it. Next slide. So to give a little bit of background of food insecurity and demographics in Austin specifically, the prevalence of food insecurity before the COVID-19 pandemic was around 11.8% of American households were food insecure in 2017. The rate or the prevalence varies by state, with families in Texas being having a higher than average food insecurity prevalence at 14% from 2015 to 2017. With over 15% of families experiencing food insecurity in 2016. From a public health perspective, this is particularly problematic because there are various health conditions that are associated with food insecurity, including diabetes, type 2 diabetes, hypertension, obesity, among others. This is also particularly relevant because for those of you not familiar with Austin, Travis County, it's a diverse area. Almost 50% identify as white, over a third Hispanic Latinx, over 7% are Black, and over 7% are Asian. Next slide. So food insecurity is often discussed with food access, and there's a reason for that. Food insecurity has four major domains: availability, access, utilization, and stability over time. And programs trying to mitigate food insecurity often focus on food access, specifically geographic food access and economic food access. Geographic food access means that you're able to find foods available in the areas near your home, and economic food access means that they're affordable items that you can purchase near you for food. You'll see some of the most common policies or interventions are trying to bring different supermarkets, mobile markets, farmers markets, et cetera, into different areas with limited geographic food access, or programs such as the Supplemental Nutrition Assistance Program trying to improve economic food access by making foods more affordable for those most in need. Next slide. And there are some key disparities across food insecurity and food access within the literature that I think are particularly salient and important to keep in mind during the COVID-19 epidemic. One of them being race ethnicity. People of color are more likely to be food insecure and less likely to have food access locations located near their homes. Individuals who are lower income are also more likely to be food insecure. There are some really interesting issues based upon urban and rural areas. If you are unemployed, you're more likely to be food insecure. And if you have limited transportation options and don't have your own personal vehicle, you're more likely to be food insecure and also more likely to have issues with geographic food access. Next slide. So what about all of this during COVID-19? Anecdotally, we've heard about these incredible food lines or lines of cars at food banks, such as in right here in Austin in the Central Texas Food Bank system. But these data are pretty hard to really obtain in a rapid, timely manner. So when we look at the data that we've been able to understand a little bit from, in the next slide, you'll see that since there are a variety of factors that can contribute to food insecurity, unemployment being one of them, the fact that the unemployment rate has risen up to 14.7% in April 2020 is really relevant and alarming for future food insecurity trends. Feeding America has done some projections about what could happen with food insecurity due to COVID. And their estimations are that between 3.3 in the most conservative estimate and up to 17.1 million in the most extreme estimate, more Americans could become food insecure due to COVID-19. And so to put that in perspective, 37.2 million Americans were food insecure in 2018. So that's almost 17.1 is almost half of that number. So it's a pretty staggering projection if it's the most extreme circumstances. And then additionally, you can get some more state level and county level information about SNAP applications and the number of residents on SNAP by county in Texas. And from January to May 2020, there are 600,000 more Texans on SNAP, or the Supplemental Nutrition Assistance Program, and 20,000 more Travis County residents specifically are on SNAP. I'll talk a little bit about this more when I talk about some of the things that we're seeing in the 211 data. But this provides a little bit of a snapshot of kind of a bird's eye view of that there's definitely some food insecurity needs, but it's important to try to figure out how we can best understand them. And so with that, I'll hand it over to Sam, who will talk a little bit more about what the city's doing and their response.
Awesome, thank you, Katie. So like Katie mentioned, my name is Sam Knight. I work in the City of Austin's Office of Sustainability on our food policy team. And so what I'll do today is give a little bit of background on the city's response to the pandemic, specifically related to food access and what our team's work has looked like since the start. I'll give some examples of food distribution models and what the food team has been working on over the past few months. And then I'll touch on the city's need for data related to food access since the pandemic started. So next slide, please. So Austin Public Health has been leading the city and Travis County's overall response to COVID-19 and to the pandemic. And so as part of that, our office and the food policy team, which includes the food policy manager, another food policy advisor, and myself, our team was tasked with managing the food access response specifically. So to give just a little bit of background on what that structure looks like, the city and county response to the pandemic writ large has been happening through an emergency operations center, which is kind of a highly structured, formalized organization that's managing everything about the pandemic, from testing to the impact on the community. And so as part of that structure, they included a social services branch, which was really put in place to ensure that the impact of the pandemic on people was fully captured, and that the city's response wouldn't just focus on hospitalizations and testing. So again, just really looking at the impact on people and on their lives. And so food access was included as a major part of that. And again, we work with Austin Public Health pretty regularly. They have staff specifically dedicated to food access, as do other city departments, but the food policy manager and our office, the food policy team specifically, was tasked with this specific piece. So when very early on in the pandemic response, I guess now that kind of third week of March, our team convened our sort of informal network of organizations and other departments and people that we regularly work with related to food access to get together and coordinate what the response would look like. And within a couple of weeks, this group was formalized as that emergency operations structure took place. And so the food access coordination group became the food access task force. And so that's kind of the structure that we've been operating in for the past few months. And our team specifically has served as mostly a convener and as a central point of coordination and communication. So that means being a liaison between city and county policymakers and the emergency feeding organizations that are participating in the task force. So a huge part of that is not only communicating information from the city to the task force, but again, communicating what the needs are among emergency feeding organizations back up to city officials. It can include advocating for funding for food access strategies and really navigating a lot of the policy changes that are impacting the work that those emergency feeding organizations are doing at the ground level. And next slide, please. So I'll talk a little bit about some of the specific programs and initiatives related to emergency feeding. Katie touched on the prevalence of food insecurity in our community, and I just want to emphasize that we know that communities of color and low-income communities in particular face existing and disproportionate barriers to food access, whether those are physical, so transportation or the availability of healthy food retailer, or economic. And that dynamic existed prior to the pandemic. But COVID-19 and the response to the pandemic not only exacerbated those existing barriers to food access, but it also created new ones. So what we're seeing, again, from some of that anecdotal evidence that Katie mentioned since the beginning of the pandemic, is not only an increase in the level of need, but changes into the kinds of needs and more diverse types of needs that we're looking at. And so early in our response, we had to identify where the most immediate needs were when it came to emergency feeding, and estimate kind of how much they were growing, and how much we might expect them to grow. And again, really difficult to do without data, which we'll touch on later on in the presentation. But we do know that there's a pretty significant group of people in Austin that are kind of in that one paycheck away status, where they may have never needed food assistance before, or they've never needed to use food resources before the pandemic, but now they did. And so that's a huge group of people that, you know, in our regular food access work, we might not have been focusing on the specific needs of that population, but the pandemic introduced that population into the group that we now needed to not only document and understand their needs, but develop solutions and really get them connected to food resources. So a lot of what was happening kind of in early March was that sort of crisis response mode, but then we also were in the process of fixing this is going to be a marathon and not a sprint in a lot of ways, and that we needed to meet emergency food needs in the very, very short term, but also that the situation was going to be ongoing and probably increasing as well, which is still what we continue to see. So just to give some examples of what that emergency response looked like, this could be populations experiencing homelessness. So in the beginning of the response, many soup kitchens had to shut down due to safety concerns among staff and volunteers. And so there was a real need to recognize that without that critical resource, the food needs of populations experiencing homelessness in Austin were just not being met. And so that process involved recognizing that those needs are pretty diverse and that we needed more than just one solution to meet those needs. So the EAT initiative was formed to provide shelf-stable and prepared meals through through a network of organizations that work with populations experiencing homelessness. So in some areas, they would be organizations would distribute bags of shelf-stable items, which would provide a week's worth of meals. And in other areas of the city, a daily distribution of prepared meals was going out. So that initiative has been going since March and was just extended for another 6 weeks. Other needs that we had to meet in the short term were personal protective equipment, or PPE, for emergency feeding organizations. In the early days of Austin's stay-at-home order, there was a real concern that emergency needed to be considered essential services, and that even volunteers needed to be considered essential service workers during the stay-at-home order. And so a letter was sent out from the food policy manager that organizations could carry as documentation. And we also have been asking for the last 3 months these organizations to document their needs for PPE so that we can report those to the Emergency Operations Center. And we've been able to distribute masks and gloves and other things that those organizations need to do that critical work. Again, we'll touch on this in more detail, but different kinds of food distribution models. So working with different organizations who had to pivot their models and increasing the availability of food access resources, whether that's grocery boxes with delivery, whether that's access to food retail outside of a traditional grocery store, or a real need that we saw for increasing the availability of prepared meals to meet the needs of people who could not cook for themselves or prepare food at home. So immunocompromised, vulnerable seniors who may previously have had someone in the home helping them, but then didn't, and COVID positive residents. And finally, food recovery efforts. So working with that network that we already had relationships with different food recovery organizations, but when restaurants started closing, helping those organizations figure out where to source food from, and then again, how to coordinate food recovery efforts so that the distribution of that food was equitable. We've also continued to meet with partner organizations in the task force and keep those lines of communications up to make sure that we were documenting and responding to new needs. So just a couple of examples. Austin Independent School District was providing meals for caregivers and parents in the very early on in the pandemic response, and that service ended after a few weeks. And so based on feedback from organizations in the Food Access Task Force and from community members, our team was able to express that community members were facing an increased burden when that service stopped. And so that ultimately developed into reporting up through the channels of the Emergency Operations Center, and ended up with a council resolution that would authorize funding and begin the reimbursement process through the CARES Act to provide those meals. Another example is for WIC families. Several WIC clients were reported facing barriers to shopping in person, whether they had a newborn or potentially an immunocompromised family member at home. And so we are working with Austin Public Health and with the local WIC office to start a pilot program in which a proxy shopper can actually go out, purchase groceries for a WIC family using their WIC card, and then provide a contactless grocery delivery. So those are just some examples of kind of the immediate needs. And then again, some of those needs that we didn't realize or weren't a priority necessarily in the beginning of the response, but developed throughout the kind of early weeks and months. Next slide, please. So I just want to touch briefly on kind of the nuts and bolts of how we're working with the organizations in the task force. There's over 75 different organizations, city and county departments, and other specific organizations participating in this. So I'll just talk a little bit about some of the communication functions that we set up. This group has, in the beginning, it was a twice a week call that has now been changed to a weekly call, where we ask organizations to report out on any needs that they have, unmet needs, changes in services, really anything that has come up for them that they need either those needs met or that they can coordinate with other groups on. And so we're still hosting those weekly calls. We send out a weekly digest to over 200 contacts in the area, just documenting, again, policy changes, news related to the food access response, really anything that we either don't have time to discuss or that comes up in between those calls. We do report regularly to the Emergency Operations Center. So again, such an important piece of this has been taking the information that those organizations provide to us and reporting those back kind of up the channels to the powers that be. And again, the food policy manager regularly briefs council members, city management, other EOC representatives from the social services branch on what the immediate needs are. We also have a partnership with United Way 211, who has been just truly a phenomenal resource for us and partner for us throughout this response. They have a website called Connect ATX, where if you don't want to call 211 for whatever reason, you can access this website and look at all of the food resources specific to COVID-19. And so again, early on, we worked with United Way and 211 to create a map of all of those resources for community members to access. And again, that map is now playing into some of the research that we're working on with the School of Public Health. And finally, a lot of this work has just been kind of informal facilitation of connections between organizations. So a lot of what we were doing early on and are still doing is fielding questions or emails or people bringing up issues to our attention that they hear from community members and facilitating those connections between potential solutions or other organizations. So for example, one of the food recovery organizations that we work with needed cold storage pretty immediately so that the food that they had recovered would not go bad. And so we were able to connect them to the Austin Convention Center who could provide that cold storage space. Next slide, please. So I wanted to just touch a bit more on a few of the specific food distribution models that the city and the county have provided funding for. The first one is Keep Austin Together. This is an organization that is using a commercial kitchen and restaurant employees who were formerly employed, but then lost their jobs when the stay-at-home order went into effect and when restaurants were obviously not in operation. So they're working to prepare meals and then distribute those through a network of other emergency feeding organizations. And again, really meet that need for prepared meals to individuals who are not able to utilize a grocery box or other kind of service. The next is a neighborhood pop-up grocery model. And so in this model, we have 11 restaurants currently participating. And what these restaurants are doing is instead of providing, regular restaurant service, they are converting to a retail model. So they will offer either grocery boxes that include produce from local farms, as well as shelf-stable items for a contactless pickup, but some are actually able to convert to a market, kind of similar to a healthy corner store. And some are actually able to have people come in and choose food, again, similar to that healthy corner store model, just depending on the restaurant's capacity. And so the city worked with the Sustainable Food Center, who's the organization implementing this program, to develop the criteria for choosing restaurants and to make sure that those restaurants were going to be in places with high barriers to food access that would benefit the most from this healthy retail model. And finally, we're working with an organization called Good Apple and their Stay Home, Stay Healthy initiative. In this model, they are providing grocery delivery to elderly or immunocompromised individuals. And so people who need this service are able to go fill out an online form, determine their eligibility, and then they can get a weekly grocery delivery that offers fresh produce and other shelf-stable items that will be enough for a week's worth of food. And I know Heather will touch on the work that Farmshare Austin is doing similar to these other models. Next slide, please. So just wanted to touch briefly on some work related to policy and funding. A lot of what we've been doing is communicating policy changes to organizations in the task force. So in the beginning, that was working with our Intergovernmental Relations Office to really dig into changes in the federal relief legislation, mostly successfully ours, like the stimulus checks and kind of other provisions that were authorized, but mostly focusing on changes to SNAP and some of the other nutrition programs. We've been working recently a lot more on the pandemic EBT program and doing outreach around that, and really just providing that information out to organizations. We have also been coordinating and in conversations with different organizations and departments about local funding streams. So whether that's from the Office of Sustainability, Austin Public Health, who had a big grant program through RISE funding, the county, and again with the United Way Altogether ATX Fund, just conversations about what those local funding streams could look like. And again, being in communication with local policymakers and making sure that they're aware of critical food access needs and what the funding needs associated with those are. And next slide, please. And finally, I'm gonna turn it back over to Katie to talk about the specifics of her research, but I just wanted to talk briefly and acknowledge that in the beginning, most of our planning efforts were, again, based on that kind of anecdotal evidence. We knew that there were huge increases in food access needs, again, not only in the level of need, but in the kind of need that needed to be addressed. But we did not have any kind of hard numbers or rigorous information, rigorous research about who those high need populations were. And so our planning efforts have been informed right now on either existing data in organizations participating in the food access task force, communicating to us what they're seeing on the ground and what their needs are within the populations that they are working with. I will say that a great silver lining, if you will, of this response has been that our food policy team, food access team, has really expanded our network. And so just an example, we previously did not work too much in the space with senior hunger, but during the response have really developed relationships with organizations and with other departments that are focused specifically on the needs of seniors and low-income seniors. And so that was just a huge blind spot for us. But working with these organizations, we have learned so much about the needs of that population and are now working to address them in a much more substantive way. So again, our goal through this project that Katie's going to talk about a little bit more is just really to identify where the highest need populations are, not only to inform resource allocation at the city and the county level, but to inform planning for the medium and the long term, as we know that the effects of this pandemic are just really going to be ongoing. And then finally, I just want to touch on what's next really briefly. Right now, we're kind of in that transition period from going from immediate crisis response to planning for ongoing needs. And a lot of that depends on how long the official pandemic response will last. So how long we will be operating kind of within this emergency operations center framework. But again, kind of going from that emergency, what needs to happen today phase to what's going to need to happen in 3 months and in 6 months and planning for that. The Austin Travis County Food Policy Board passed a really substantive recommendation focused on funding for food systems efforts and funding for food access in particular in response to the pandemic. And so we've been working with them and again, trying to incorporate some of those recommendations into our planning efforts. Again, Katie will talk about the project in more detail, but incorporating the findings from this research into our policy and planning work, which includes regional food systems planning and really recognizing a need for a food systems resilience plan for in the future. And so with that, I will turn it over back over to Katie to talk a little bit more about the nuts and bolts of this project and her research.
Thank you, Sam. So the purpose of this research, as she just mentioned, was to identify areas with unmet food needs due to COVID-19 with 211 call data. Next slide. So a little bit of background on using 211 call data. The United Way for Greater Austin and many other United Way branches across the country manage these different 211 call programs and these different 211 call lines. And with the 211 call line, individuals can call 211 and discuss a need that they need to have filled and then be connected to resources in their area. For instance, if I called 211 and said that I would really like to have more information about a food bank in my area, they would ask for my zip code and then connect me to various food banks that are located within my zip code or in neighboring or nearby zip codes. And be transferred to the Health and Human Services Commission about specific benefits such as SNAP, Medicaid, etc. And I'll kind of talk a little bit more about those transfer calls later on. I began working with 211 call log data using 2018 call data to identify areas with food needs and limited geographic food access in their service area as part of my dissertation. So I actually defended that in the beginning of April. So right when this pandemic was really kind of gaining steam and we were all sheltering in, or starting to shelter in place. And it was clearly a very obvious application that these methods that I utilized for my dissertation could be adapted and applied to the current situation in order to identify areas with unmet food needs due to COVID. Next slide. So again, the purpose of this analysis was to identify areas with unmet food needs due to COVID-19 in Travis County. This is conducted or able to be conducted in order to analyze data not only during the pandemic, but also before the pandemic in order to kind of get a better understanding of the context of how this was all occurring, but also to look at data from the previous year in order to determine seasonality, kind of have some type of a natural control comparison group. The analyses that I'm presenting and data that I'm presenting today are from January to April, but we will be continuing analysis with May, June data and so on. So don't think that we just stopped on April. It's just what the state of the data are right now. We're also able to analyze call data by call reason and look at these different prevalence of calls by zip code. Additionally, Sam and colleagues at the City of Austin are wonderful and share the previously aforementioned map of food access locations during COVID-19, which are also incorporated into our analyses. For the sake of this webinar, I'm just sharing some of the descriptive statistics about the call data in 2019 and 2020 and some of the call reasons. Maps are not being shared today, but they will be available in reports once they are finalized. Next slide. So here are some data regarding total calls to 211 by month. And again, these include call reasons to 211 as well as transfer calls that were calls made to 211, but then were transferred to the Health and Human Services Commission about those different benefits. So you can see calls made by month with all the calls being made in 2019 in a lighter blue and 2020 in a darker blue. You can see that seasonality typically plays a role where there's a high call volume in January, it dips a little bit in February, a little bit more in March, and then increases a little bit in April, but not to the level of those January calls. However, with the darker blue colors, we see a clear departure from that trend, where there's a high call volume in January, it dips a little in February, goes up dramatically in March, and then even more so in April. But again, what type of information is available about food calls? And that's available on the next slide. So in the food calls, you kind of see that similar trend of it being, and with the 2019 data of it being in light blue again, of it being a little bit higher in January, goes down a little bit, goes up a tiny bit, goes up a tiny bit more in April, but still lower than the number of food calls that were in January 2019. However, again, we see a clear departure from this in 2020. January is high, February goes down a little bit, March rapidly increases, and then April soars. And the driving factor for that huge growth in food need calls in April 2020 were because of a huge volume of transfer calls that were being made to 211, meaning individuals called 211 and then were transferred over to Health and Human Services to talk about SNAP specifically, among other benefits, but mainly SNAP. And so that's a huge driving force, and I think kind of validates some of the information that we see in those larger reports about the total number of Travis County residents that are on SNAP and how that's increased from January to May. And looking at these data in May and June and so on will, I think, help portray a little bit more of an even richer picture of what's going on with this. Continues. But we also wanted to look at other needs and not just food, just to have a whole picture of this. And can you go to the next slide, please? So here you can see January and February calls in the top row, and graphs of the March and April calls in the bottom row. And these include calls about food, which is in that darker blue color, as well as finance, health and mental health, housing, transportation, utilities, and another reason. Typically, health and mental health is like the primary reason that individuals are calling 211 in terms of call volume. And you see that that is not the case in April, and that the proportion of food need calls is growing in March and April compared to normal. And I think it's really important to understand also that individuals who suffer or are dealing with food needs are also dealing with a whole suite of other issues, whether that's health access, housing, etc. We know that these don't occur in isolation, but we can see that because of the COVID-19 pandemic, there's a huge increase in food calls. And you can also see an increase in housing calls proportionally in March and April of 2020. Obviously, as individuals are sheltering in place, housing plays an even more important role than what we think about on a typical pre-COVID world. So I think that looking at these data can really give an incredibly important snapshot of the different needs that are occurring in Travis County. Next slide, please. So we'll be doing some continued analyses with these data. We're going to analyze the call data by zip code and incorporate demographics of the callers when available, and also demographic characteristics of the zip codes of which the callers are calling from. We'll also be presenting maps to the city in order to identify zip codes with high food call volume and ones that also do not have food access resources based upon that map from connectatx.org. We want to emphasize that the purpose of that research is to identify areas that have these unmet food needs and not shift resources away from areas that also have high call volumes. This is just to identify those areas with unmet needs. And then we'll also be doing some continued analysis with May and June data. And I quickly want to thank Amy Price from the United Way. Without her, this analysis would not have been possible. Such supportive colleagues at the City of Austin, as well as Children's Optimal Health is doing some incredible work with these data as well, and their collaboration has been super helpful. And a recently graduated master's student Raven Hood, has been instrumental in this work. I think it is a really important thing to identify what is happening with individuals who are most in need and most in search of resources. And I think the opportunity to analyze these data paint a picture that otherwise is difficult to really truly understand. I believe Heather is next to talk about the incredible work that Farmshare Austin's doing. And I'm sure that everyone would be very interested to hear about that.
Thanks, Katie. Thanks everybody for having me here today. My name is Heather. I'm the Food Access Director at Farmshare Austin. Today I'm going to be discussing Farmshare Austin's programming response to COVID-19 and the changes that resulted in our service delivery models as a result of coronavirus ending up in Austin. So Farmshare Austin is a nonprofit organization whose mission is to grow a healthy local food community. We do this by increasing food access, training the next generation of farmers, and preserving farmland. At Farmshare, our program most directly impacted by COVID has been our mobile market program, which until March of 2020 was the primary food access work we were doing. Our mobile markets, which are shown in this image, are small pop-up farmers markets, and under normal circumstances, they operate weekly for about 2 hours at each location. These markets carry produce grown on our own certified organic farm, produce from other local Texas farms, local eggs, local honey, and a variety of healthy grocery staples such as beans, pasta, cooking oil, and more. Farmshare Austin's food access programming is part of the City of Austin's Fresh for Less Healthy Food Access Initiative, and consistent with that program's objectives, all of our products are sold at reduced costs. Prices are comparable to grocery store conventional prices, though the majority of what we sell is organic. We accept cash, credit, debit, SNAP, and Double Up food bucks for all of our products. Next slide, please. This is an example of the types of shelf-stable grocery items we typically carry at the markets. And we actually were having supply chain and sourcing issues for these items that started well before COVID, but these problems were definitely exacerbated by the pandemic. Currently, we're in the process of working with the national grocery supplier to obtain permission to buy and sell 365 organic brand products, which are typically only found at Whole Foods grocery stores. This brand was selected for its price point and overall quality. Next slide. We carry a wide variety of seasonal produce at the mobile markets, and what we offer varies throughout the year depending on what is being grown in Texas. We also make a particular effort to carry culturally appropriate produce items for our customers, and we encourage and welcome customer feedback for suggestions about items that we don't carry that folks might like to see and be able to shop for. Next slide. A major quality that we have always looked for in market host sites is that they are community gathering places. This is critical to ensuring that we're able to meet community members where they're already going rather than requiring them to make another stop during a busy day. However, this meant that many of our market host sites, such as schools, gyms, and churches, were some of the first places to close once COVID was confirmed in our area, even before Travis County entered shelter in place. We've also historically leaned on community health clinics as really important market hosts, as well as organizational partners. So pre-COVID, our busiest mobile markets by far were found at clinics in Austin, such as People's Community Clinic and the Southeast Health and Wellness Center. And in March of 2020, 4 of our 12 Travis County markets were located at various community health centers. Unfortunately, and for obvious reasons, it did not seem safe or logical for us to continue operating mobile markets at these locations, given the really urgent need to limit the spread of coronavirus in our community. Next slide. As the majority of our market site hosts began rapidly closing in mid-March, we realized that we needed to suspend all mobile market operations for the safety of our staff and our customers alike. So we took a 2-week hiatus to regroup and brainstorm. And during this time, the City of Austin encouraged us to determine other ways that we could continue meeting the food access needs of our customers. So as an organization, we went into high gear. We came up with new COVID-19 standard operating procedures, new safety protocols, really so that we could continue safely working at the farm and in our office. And we began envisioning a new food access program for our customers. And by the end of March, we were able to begin piloting it, and that was the new Curbside Delivery program. So the very first iteration of this used Google Forms to collect customer orders, and we used social media to share information about the new program. And from a technology standpoint, the first couple of weeks of this program were a massive learning curve. We are not web developers, but we did the best we could with what we had available to us. And this ultimately has resulted in an online shop connected to our regular website where customers can place orders during specific ordering windows. I think this is a little bit more user-friendly than the Google Forms were. In order to determine our service area for the delivery program, we based delivery zip codes off of areas that had already been identified in previous studies by the City of Austin as communities that have socioeconomic and/or geographic barriers to healthy food access. This is part of the criteria that we already used to determine where to locate our markets. Then we just split up these identified zip codes geographically in order to narrow and focus our delivery days, which allowed us to maximize the number of orders we could deliver in one day. We do offer a few pickup options for customers whose addresses fall outside of our normal service area. We typically get folks from many different zip codes at our mobile markets, including outside of Travis County. So this was a way that we felt that we could compromise and try to meet the needs of as many of our existing customers as possible. We also have been making occasional case-by-case exceptions for homebound, high-risk, or SNAP customers who live outside of our usual delivery that are unable. Next slide, please. In the image on the left, you can see what a typical order might look like. So just like the markets, what we offer is still changing seasonally, but in general, customers are choosing from the exact same items that they would be if they were shopping in person at one of our markets. And an order like this on the left would probably not run more than $20. It would probably be less than that, maybe in the ballpark of around $15, just as an example of the price points that you're looking at. Many of our customers choose to prepay, which allows us to offer completely contact-free delivery, as shown in the image on the right. And for our customers who want to use their SNAP benefits or their cash, we offer very minimal contact delivery, and we're just able to process those payments in person. All of our usual payment options from the markets are still accepted through Curbside as an effort to not exclude anyone from shopping with us, no matter what their financial situation might be. And this was kind of we made this decision based on things like restaurants opting for, card only and that kind of thing, but ultimately decided that we had enough PPE to just handle cash safely and try to do things like that to accommodate our customers. We did initially see a decline in our SNAP and Double Up Food Buck sales compared to our markets when this program began, but those numbers are beginning to rise again, which I think is likely due to a variety of different factors that include we've been trying lots of different outreach efforts. The program is becoming more well-established at this point and well-known. We've been working with a lot of community partners to really just try to get the word out to as many community members as possible. Next slide. I wanted to touch on a pretty big issue that we had with our program initially because it's really shaped what the program now looks like today. So when this program began, we were delivering all of the orders ourselves in Farmshare Austin mobile market vehicles, which we turned into our delivery vehicles. But in mid-April, which was only a few weeks after the program rolled out, we hit a major roadblock and both of our main delivery vehicles suffered transmission failure in the same week. However, and I feel like this really highlights the power of collaboration, Farmshare's executive director was able to pursue a partnership with Cap Metro to get our deliveries going again. And with their help, we were able to get up and running again and barely missed a beat. And this collaboration was a direct result of the weekly resource coordination calls that Sam mentioned that the City of Austin has been facilitating. So that was just an amazing connection for us to be able to make, and is a partnership that we're still in the midst of today. It's been awesome. So Cap Metro's paratransit fleet has been assisting Farmshare Austin, as well as several other local organizations, including Good Apple and the local food bank, with food delivery. And they've been an ideal partner for many reasons, but significant among them is their commitment to safety. They disinfect all of their vehicles regularly. Their drivers are always wearing gloves and a mask, and As essential workers, my team is at an elevated risk of being exposed to COVID just by the nature of this program and interacting with customers. So we just really appreciate the safety precautions being taken by all of our partners. Next slide. With CapMetro's help, we've been able to streamline our deliveries and increase our capacity up to serving 130 customers per week. And part of how they've been able to help us, which has been huge, is that they have route optimization software, which when we started this program, it didn't really occur to us how difficult it would be to coordinate making upwards of 60 different stops throughout an area in Austin without having software for that. So while this isn't as many customers as we were serving at the markets, which was probably closer to 250 customers, we're still really encouraged by the growth that this program has seen in such a short time. We now consistently hit our max capacity of orders each week, as opposed to when we began this program, when we were probably only, maybe only getting between 50 and 80 orders each week. The new service model does require more staff hours than the mobile markets did, so that's part of what limits our capacity at the moment. As a team, we're really only about 5 people, that includes me, so coming up with the hours to keep the program running with our current staffing has been a bit of a challenge. But despite this, we're going to be operating the Curbside Delivery program at this pace through the end of August, and we get more aspects of the new model down and it takes less and less time. So that's really encouraging as well. Beginning in October of 2020, which is typically October is the start of our new market season every year, we're hoping to pursue a blended model of the mobile markets as well as the curbside delivery programs. And we're really excited about that because I think we're going to be able to reach a lot more people than either program can reach individually. So the reason for doing this is that we've seen just an amazing number of rural and peri-urban customers located in areas around Austin taking advantage of this program, and those were the areas that were always the hardest for us to reach with our mobile markets. So we're hoping that by combining the two, we'll really be able to meet as many needs as possible. That will be pending our ability to reopen the markets in the fall, but that is our eventual plan. So even though this program was created in response to the restrictions that COVID-19 had imposed on our regular service model, it's definitely going to remain an important part of our work well into the future. Next slide. This is just a little side-by-side comparison of some of the key pieces of information about the two programs that I've touched on. So you can see here the differences in weekly customers reached and the weekly average sales. But the sales per customer do tend to be significantly higher through the curbside delivery model. We definitely see people shopping for more of their groceries all at once. And I have the digital divide listed here because it's really come up for us in a big way since we began operating the curbside delivery program. It's really opened our eyes to how challenging it is to reach all of our usual customers with a model that is web-based. So our customers do have varying levels of technological literacy. Some are really young and very tech savvy, but many are elderly and may not be as familiar with using the internet or using a smartphone or even a computer. Some of our customers may not be able to afford to have those things. So this tended to not be as much of an issue at the mobile markets since they were held in person. But now our outreach strategies have to include ways to ensure that individuals are not being excluded from this program just because of a lack of access to the internet or similar difficulties. So we are working on some different approaches to address this problem. And primarily our partners at Sustainable Food Center, who handle a lot of the outreach done for the Fresh for Less program, they are developing a bilingual help desk call center that our customers can call to ask questions about the program or even receive assistance for placing an order over the phone. And I think that that's going to go a really long ways in helping more people access this program. Next slide. So that's just a little overview of the programs, and we are really so grateful just to be learning every day from this program and being able to continually improve it. And We're also grateful for all the support we've gotten from our community partners, especially at the City of Austin and our other Fresh for Less partners. They've really all pivoted right alongside us, and we're very appreciative of that. So I've got my email listed here in case after the panel discussion there's any other questions or anything that anybody would like to discuss. Thank you.
Well, thank you for Katie, Sam, and Heather for some very interesting presentations. I've been working with all of you over the last couple months, and it's just really rewarding to see how, when we collaborate all together, that we can really do some really cool stuff. So there are some questions coming in, and we only have about 4 minutes left. So I'm going to try to answer, or I'm going to let y'all answer some of them. But I just want you to know, for those of you who are putting questions in the chat box, we will answer those after this webinar, and we'll just email them the responses to you. But I have one question, Katie, maybe you can answer this. The question asks, do you think that the food insecure individuals know to call 211? Or do you think that the real numbers of food insecure individuals are even larger than we can really detect with the data, with the 211 data, I assume? Katie, maybe you can answer that, or even Sam, because I know that we are really promoting the 211 number throughout all our communications in Austin.
Yes, I think that's an excellent question. There has been a lot more promotion of 211 as a resource, especially during COVID. There were billboards on highways. I know that Governor Abbott talked about it in several different press conferences in March and April. However, no amount of promotion and no survey can capture every single person who is food insecure within an area. There are issues with disclosing things due to immigration or due to other different statuses. So I think that this gives us a snapshot of what is currently occurring, but I don't think it's the comprehensive measure.
Thank you. Yes, Sam, do you want to add anything to that?
No, I was just going to say in the very beginning of this kind of food access coordination group, food access task force being formed, we had spoken with United Way and with 211 several times and decided that that was going to be the coordinated messaging coming out of all of the organizations working in this task force, was to send everyone to 211 and connect ATX, so that that message was coordinated and was presented in all of our outreach efforts consistently. So I do think that a lot of the need is captured, but just to echo Katie's point of, we would certainly expect food insecurity to be higher than just those that are calling 211 or visiting the Connect ATX website.
All right, thank you. A lot of the questions that I'm seeing are very specific, and people are asking for more information, websites, etc. We will definitely be able to give those to you. There was one question about specific information for other states about food insecurity. And I just want to say Feeding America is a really good resource. If you go to their websites, they have state level data and the county level data as well. And with that, I think we are at our time, it's 1 o'clock. I just want to thank all of y'all for attending this webinar. We are having our third webinar next week, same time, same date. And that webinar will focus on the Paso del Norte region of Texas. So, very different than Austin. And I think it will be a great presentation. So I really hope to see y'all there as well. Thank you very much.